Hi everyone, this is Kim Williams, and this is a special video that is being sent out for all caregivers and leaders to watch together so that you can respond to issues and questions. Probably no surprise to any of you, the topic is caregiver and patient safety related to COVID-19. You all received a notice last week about an occasion of an outbreak on one of our inpatient areas. And I want you to know we're going to make some changes. So you will have known that we're making some changes to visitation. But this topic today is really about your safety, the safety of your colleagues and of your patients. So number one, we have policies and procedures around which PPE folks should be wearing while they are in the building. It is an expectation that everyone be adhering to those policies and procedures, and that if you as a caregiver see someone not adhering to them, that you're reminding that caregiver of the safety aspects of masking and wearing a shield. And when we're talking about masks, hospital or a clinic provided, and they must be above your nose and over your mouth, and not in public places should folks be eating. There are designated spots for eating and drinking. In addition, we have more visitors in our hospital settings, and those visitors adhering to the policies and procedures is every single caregiver's responsibility. If you see somebody in the building who has traded out their hospital provided mask for a cloth mask, please help them find a hospital mask. If they have their mask below their nose, please remind them. They should not be out in the hallways. They should not be out at the nurses' stations. They should be in the patient's room with the patient. And patients should be masked absolutely whenever possible, particularly when you're in the room or if they're in a semi-private room or with their loved ones. Please understand, this is about your safety. This is not about folks making up rules to make things hard. There does seem to be maybe a bit of confusion about whether the executive team is making these rules or department leaders. Know that the infection prevention decisions are being made for our entire system. And if in fact there is any leeway, that is a regional decision. So these are not decisions made by your managers or directors or me. And I know that in the community, there are some of you that think that you prefer not to wear a mask, that you think that this is something other than a communicable disease that we should be engaged in our regular lives wearing masks. When you're in the building, the expectation is you will adhere to the policies and procedures. I am happy to take any questions that you may have, but would ask that you make every effort to keep patients and your colleagues safe, and that means you're wearing a mask. Our visitation is going to be reduced and may have already been reduced to a 4-hour block, and that visitors will no longer be able to go to the cafeteria, purchase food or beverage, and remove their mask in the patient room. If you walk into a patient's room or a treatment space or a waiting room and they have their mask down or not on or below their nose, everybody needs to remind them above the nose and over the mouth. So I know we are all working hard and I know everyone is COVID tired, but we are the largest healthcare system in the county, and it's our obligation to keep our patients and our colleagues safe. So thanks everybody, and I appreciate you taking a few minutes to listen.